10 warning signs of cervical cancer you shouldn't ignore. Cervical cancer is one of the most common cancers in women worldwide. It occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. Being an adult woman, if you notice any unusual changes or symptoms affecting your reproductive organs, consult your doctor. Always bear in mind that your chances of successfully treating cervical cancer are higher if it is detected during the early stages. With the use of pap tests and the HPV vaccination, it's become possible to treat as well as prevent cervical cancer. With knowledge of the risk factors and warning signs of cervical cancer, you can save yourself and others from a lifetime of suffering. Here are the top 10 warning signs of cervical cancer you should not ignore. 1. Abnormal vaginal bleeding. An untimely bout of vaginal bleeding that occurs regularly could be an indicator of cervical cancer. It could also be due to other medical conditions, such as a hormonal imbalance, pelvic inflammatory disease or an infection in the pelvic organs. 2. Unusual vaginal discharge. When suffering from cervical cancer, vaginal discharge could be heavy, pale, watery, brown or mixed with blood. 3. Pain during intercourse. Painful intercourse is another important warning sign of cervical cancer. This symptom indicates advanced cervical cancer, which means the cancer has spread throughout tissues and reproductive organs. 4. Pelvic pain. Pelvic pain is common among women. Cramping and aches are a normal part of the menstrual cycle and do not usually indicate the presence of cancer or any other serious condition. However, pain that lasts for longer periods of time and occurs more frequently could be a sign of cervical cancer. 5. Discomfort while urinating. Urinary discomforts include burning, stinging or a tight sensation while urinating. Such symptoms occur when the cancer has spread to nearby tissue. This requires immediate attention to prevent further damage. 6. Heavier and longer menstrual periods. Menstrual periods that are heavier and longer than normal are another common warning sign of cervical cancer. Irritation of the cervix, possibly due to spread of cervical cancer, can cause this problem. 7. Loss of bladder control. Bladder control is a primary issue when suffering from cervical cancer. It typically indicates that the cancer has spread beyond a localized area and is affecting the bladder or other parts of the urinary tract. People diagnosed with this cancer often experience loss of bladder control coupled with blood in the urine. 8. Unexplained weight loss. The body produces small proteins called cytokines, which break down fat at a much higher rate than normal. This leads to weight loss, irrespective of your diet. If you are suddenly losing weight and have some of the other symptoms mentioned in this article, it could be due to cervical cancer. 9. Constant fatigue. When suffering from cancer, healthy red blood cells are replaced by white blood cells to fight off the disease. This causes anemia, leading to fatigue, lack of energy and loss of appetite. In addition, there is decreased oxygen supply to the body. 10. Leg pain. Women diagnosed with cervical cancer often experience swelling and pain in their legs. When the cancer spreads, it obstructs blood flow, which causes swelling in the legs. Swollen legs often create a sore, painful sensation, making it hard to carry out your day-to-day activities. And now I know my